Hi, my name is Kevin. Today, we are going to do breast examination. As you begin the examination, take a courteous, gentle approach. Let the patient know that you are about to examine her breast. Because breast tends to swell and become more nodular before menses from increasing estrogen stimulation, the best time for examination is 5 to 7 days after the onset of menstruation.
Begin the exam with inspection. Thorough examination of the breast includes careful inspection for skin changes, symmetry, contours, and retraction in 4 views: arms at sides, arms overhead, arms pressed against hips and leaning forward. Inspect the breast while arms at sides. Check for appearance of the skin, including color, thickening of the skin and unusually prominent pores, size and symmetry of the breast, contour of the breast, the nipples, including size and shape, direction in which they point, any rashes or ulceration, or any discharge. To bring out dimpling or retraction that may otherwise be invisible, ask the patient to raise her arms over her head. Then press her hands against her hips to contract the pectoral muscles. Inspect the breast contours carefully in each position. If the breasts are large and pendulous, it may be useful to have the patient stand and lean forward.
Let's go now to palpation. The patient should be supine. Palpate the rectangular area extending from the clavicle to the inframammary fold or bra line, and from the mid-sternal line to the posterior axillary line and well into the axilla, to ensure that you examine the tail of the breast. Begin at the lateral side of the breast. Ask the patient to roll onto the opposite hip, placing her hand on the forehead but keeping the shoulder pressed against the bed or examining table. Use the pads of the second, third, and fourth fingers. Begin the palpation in the axilla, moving in a straight line down to the bra line. Then move the fingers medially and palpate in a vertical strip up to the chest to the clavicle. Continue in vertical overlapping strips until you reach the nipple. To examine the medial portion of the breast, ask the patient to lie with her shoulders flat against the bed or examining table, placing her hand at the neck and lifting her elbow until it is even with her shoulder. Palpate in a straight line down from the nipple to the bra line, then back to the clavicle, continuing in a vertical overlapping strips to the mid-sternum. Examine the breast tissue carefully for consistency, tenderness, and nodules. Palpate each nipple, noting its elasticity. If there is a history of nipple discharge, try to determine its origin by compressing the areola with your index finger placed in radial positions around the nipple, noting the color, consistency, and quantity of any discharge and the exact location where it appears.